Hello, Eddie. Good afternoon. Um, Thank you for joining me today for today's COVID-19 update. Director A.J. Gary is here from Adam, who's done a good job in our procurement through this emergency. Dr. Nate Smith is out today. No, he's not quarantined. I'm sure that's the first question that comes up. He just had some scheduled activities that he had to be responsible for. And we're joined by Dr. Jose Romero. And thank you for joining us, Doctor, today. Let me first thank all of our healthcare workers that are doing really extraordinary work under very difficult circumstances in the heat of the fight for lives in the hospitals. And no one can understand what you're going through, and we're grateful for it, particularly those that are seeing the increased number of cases and hospitalizations in Northwest Arkansas in our partner hospitals there. And so I just wanted to acknowledge their work, their commitment, and their sacrifice, and understand that they're under a strain right now, and we recognize that. I want to go through the cases. Yesterday we had, in terms of overall cases that have been identified as positive during this pandemic, at 10,816 cases. We have increased 731 cases in the last 24 hours. And yes, that's the largest increase we've had in both in community cases and total cases since this pandemic began. That brings us to a total of 11,547 cases here since the pandemic began. Of those, we have 3,764 that are active cases. 3,764 active cases. Now, in terms of hospitalizations, we've had 16 additional hospitalizations. That brings us to 203. And we have 5 additional deaths. That brings us to 176 deaths. Going back to the cases, the 731 new cases over the last 24 hours, 207 of those have been in the correctional institutions, and the largest increase has been at East Arkansas Regional Facility in Lee County, and so that represents the greatest number of the 207. The rest of those are community cases, and so here again you can see the large number of community cases. Of those, the top counties are Washington County with 220 cases, Benton County with 91 new cases, Madison County with 32 new cases, which is a significant development since it's obviously right next to Washington County, but that's a large increase for a rural county in Arkansas. Lee County, of course, had a significant increase because of the correctional facility there. Pulaski County with 25 new cases, and Sebastian County with 24 new cases. The rest of them are under 20 cases scattered across the state of Arkansas. And so those are the cases, the counties of particular concern that we see, the typical growth area that we've seen over the last few days in northwestern Arkansas. In terms of testing, we continue to do an extraordinary amount of testing in Arkansas. Last 24 hours we've done 5,591 tests, which is far above what we need to do each day to accomplish our goal of 120,000 tests over the course of the month. So we continue to expand that here in the state. We are at represents a higher positivity rate than we've had. That's 7.1%, which could be adjusted upward, as you know, since we'll add some more numbers into there. The most important statistic probably is our cumulative positivity rate is 6.2%, which is cumulative since we started this pandemic. Let me go through the graphs that tell the story in more dramatic fashion, actually, and you can see how high this represents with the new new peak, actually, in new cases, both the white representing the correctional and the orange representing the community cases. And you can see the highest level of community cases that we've had since the pandemic, significantly. The total number is higher as well. You go to the 7-day rolling average, obviously that kicks it up, and it's going to be some time before we start seeing that trend come down because of the rolling average and this particular spike that we have right now. If you go to our active cases, those that are we're having to deal with, and this is real because this means this is the number we have to do our contact tracing on. These are the ones the nurses have to monitor. These are the ones that have to be quarantined and isolated. And so that number is over 3,764 Arkansans right now are active cases here in the state. And you go to the next slide is the number of currently hospitalized. We can continue to watch that. We've gone over 200 hospitalizations in Arkansas, which is significantly higher than when we were really at what I thought was the first peak in April, and now we're at a little over 200 in hospitalizations. I'll come back to that, and let me come back to a point though. Tyson's Foods, to their credit, did a news release yesterday reciting this, but I wanted to draw attention to it, where they have been testing all of their employees in various facilities, and so they tested all employees, over 1,100 team members there at the Berry Street facility in Springdale. This was in combination with Matrix Medical, as well as their contact tracing team that will follow up on these. But of the 1,102 team members that were tested, as you know, 199 were positive. Now, that's not startling at all. That's a high positivity rate, but it's still not startling because we know that there were positive cases in this particular facility. The significant fact that I hope everybody pays attention to is that of the 199 positive cases, only one was symptomatic. Only one out of 199 were symptomatic when they were tested. That means 198 of these individuals showed no symptoms, but because everybody was tested, they knew they were positive. Now think about where those 198 were the night before when they were positive, or the evening before, or the day before, in the community, with families, buying groceries. And so this illustrates the importance that just because somebody might feel ill, they'll stay home and they isolate themselves. But there's many out there, I think you can say, that are not showing any symptoms. They are not aware that they are positive, and yet they're capable of spreading the virus. And for that reason, it is critically important we go to this, which is from the CDC out of Atlanta, which is simple health guides, health habits that we should all follow. Stay at least 6 feet away from others. If we do that, then we don't have to worry about that person coming toward us or walking beside us. If they're 6 feet away, then we know we're not going to contract the virus because of that distancing. Avoid contact with people who are sick, which everybody is helping with. Wash your hands often with soap and water for at least 20 seconds each time. Use hand sanitizer if soap and water are not available. And you go to the next one, it leads into use the face covering to help protect others. This is a common courtesy. This is something that we show respect for someone we might come in contact with, not knowing that we ourselves might be positive and totally be unknown about it. Wear a face covering to help protect yourselves in case you're infected but don't have symptoms. Protect others. Cloth coverings prevent respiratory droplets, as we know, sneezing or coughing from spreading in public. Keep the covering on your face the entire time you're in public. Don't put the covering around your neck or your forehead, which is a surprise to many. Don't touch the face covering, and if you do, clean your hands. This is how you keep from spreading the virus to others, even though you might be positive, and also will help you as you go in public as well. These are very simple, important guidelines that I wanted to remind everyone, and that is what allows us to do business, to go to school, to go to work, to live life if we follow these guidelines. If not, we're going to continue to see cases go up for an undetermined period of time in the future. I did want to make one announcement today, and that is because of the need for contact tracing with this spike in cases that really puts a stress on the nurses and our contact tracers. We need more resources there. And so I've authorized 20 National Guard members who are specialized and have the capability of doing this to immediately be brought into active duty to assist the Department of Health in contact tracing. Secondly, we do have an RFQ, which is just simply a notification that we want vendors to come in and say we're willing to contract with the state to do contract tracing. That is being accelerated so that we can select a vendor that will be helpful to us in meeting the requirements of the new cases that we see and the contact tracing that is necessary. And then finally, I do want to just look at the future for a moment. And as I look into next week, I do expect the cases to continue to increase. I think that is natural whenever we see the pattern that we've seen over the last week, particularly in Northwest Arkansas. I expect that to continue to increase until we can get a handle on that and reduce that spread. And so with that, we'll stay tuned for next week. And again, I want to thank our healthcare workers that are laboring so hard and long with a great deal of stress as you try to help people during this time. And I appreciate Dr. Romero coming and invite him to make comments.
Thank you, Governor. So I will add a little bit of granularity to what the Governor has already provided. So we have 731 new cases. 207 of those are from correctional facilities. 524 from the community, of which 1/3 of those come from the report by Tyson from yesterday. That gives us a total number of cases of 11,574, with active cases of 3,764. There are 144 cases in nursing homes, 402 in correctional facilities, and 3,218 in the community. To date, there are 844 healthcare workers infected. The change is up 12 from yesterday. With regard to the nursing homes, we have 7 new residents infected and staff infected at 4 more. That means that we have 509 residents infected and staff of 339. The largest number of cases contributed to the correctional facility total comes from the East Arkansas Regional Unit. Currently, there are 203 individuals hospitalized. 16 of those increased from yesterday. With regard to ventilator use, there was an increase of 4 individuals requiring mechanical ventilation for a total of 49. Deaths were increased by 5 for a total of 176. Recovered patients are 7,607, or 66% of cases. With regard to demographics, 51.5% were white Caucasian, 30.7% were African American. Latinos comprised 21.2% based on surname, and Marshallese 6.2%. The governor has already explained the number of cases in counties. The top three counties are Washington, Benton, Lee, and Madison are tied for third position. With regard to testing, yesterday we tested 5,591 individuals. There were 395 positive for a positivity rate of 7.1. And as mentioned by the governor, our cumulative average positivity is 6.2%. Total number of individuals tested to date are 182,645. We are at 43% of our goal as of today for 120,000 cases this month. With regard to cases and businesses, we currently have a total of 1,353 cases in the poultry business. Number of cases recovered are 671, and the current active cases in that business area are 68.2. And I'd just like to add a little bit of comment to what the governor has already explained so well. I think that what we're seeing and what has been exemplified by the recent numbers that have come from the Tyson report is the relatively small number of individuals that are presenting with symptoms. The numbers are less than 1%. So while these individuals have no symptoms, they do have the capacity to transmit the virus in the community. We have an obligation to protect our fellow citizens, and to do that, we should wear all masks when in public. By wearing that mask, if we are asymptomatically infected, we decrease that risk significantly. More and more data is beginning to be published to indicate that masking is very important for controlling the spread of COVID. There's been a recent study that showed that in families, tight-knit families, where individuals wore masks, that is, infected individuals wore masks, there was less of a chance of infecting other individuals in that family. And you can imagine that they're all living very close together. And so if in that environment you can decrease transmission, you can certainly do so in public. So again, the basic tenets are use a mask in public, cover your cough, wash your hands, and maintain that 6-foot distancing in order to decrease transmission in our communities. I'll turn it back over to you, Governor. Thank you.
Thank you, Dr. Romero. With that, we'll take any questions.
Well, I guess the obvious question is, with the current spike here, are we having second thoughts about some of the reopenings, and are there any considerations into maybe pulling back on some of those?
No, again, and I've visited with Dr. Romero before coming in here, and there continues to be no indication of a connection between the increase in cases and the lifting of restrictions. And that's what we continue to watch, and that's what helps guide our decision. And I think that as Dr. Romero said, and as I've indicated, what we have to do is to protect others. We have to act with discipline and responsibility, and that's the solution, or that's the direction we need to go. And with that, we can live and we can work, and we won't have to be on the unemployment line if we can maintain these simple acts of discipline that will help us to avoid that spread. Yes?
Would you encourage people who live in these hotspot areas to stay home?
Certainly, if they are in a vulnerable age or they have some preconditions health-wise, then they should be very careful of going out in public or make a decision to stay home. In fact, the Phase 1-2 guidelines do indicate that vulnerable citizens should continue to stay at home if that would compromise them in going out.
In Northwest Arkansas, how bad do you see this getting in the future, and will they have adequate hospital space, or do they need to take additional steps up there?
Within the last couple days, I've spoken to multiple hospital administrators there, and monitoring that very carefully as to their capacity. And they do have surge plans in the event that it gets, their normal operating capacity gets a concern. They do have a capability to expand that for additional COVID patients as needed. They want to be able, and there's an urgent need to continue to do the pent-up demand for elective surgeries. And so they are doing both COVID patients as well as in other areas of the hospital, of course, doing their normal activities. They need to be able to do both for the citizens as well as the purpose of the hospital. And so that's something we're watching very carefully, and we're making contingency plans in the event that we do have a capacity issue in terms of COVID patients. Is there a question remotely?
Yeah, Governor, this is Andrew with AP. Given what you and Dr. Romero were talking about with the number of asymptomatic cases that you're seeing, even with going into phase 2, do you think there needs to be restrictions or mandates on people wearing masks when they're in public? Does that mandate need to be added? And also on the decision to go into phase 2, did your medical advisory committee that you had formed, did they play any role in this decision? Did you consult with them? Did they have any recommendation?
Yes, that is correct. And so there's a medical advisory board that they were summoned. They all expressed their views on this, and based upon the counsel of that medical advisory board through Dr. Smith, we made the decision to go into phase 2. And that was based upon the data and the science, and also the fact that there was not any correlation between lifting restrictions in phase 1, what we did, and what we see today, and any growth in cases. On your first question, we're not going to give a directive that everybody in the state of Arkansas has to put a mask on when they're out in public. That would not be enforceable. It would not be realistic in a rural state whenever they can socially distance in many circumstances. It's just not Arkansas, so we're not going to do that. But it is important that we do it. And just as and I'm going to invite him to come up and make an additional comment on this, but Dr. Romero has already said his advice is when you're out in the public, wear a mask. If we can clearly socially distance, we can take the mask off, but whenever we get within 6 feet, we've got to put it on, and that's how we get through this and manage the risk. We do have that mandate in terms of many of our licensed facilities, from restaurants to also dentist offices and things like that, that there are requirements then in those places for mask wearing under certain circumstances. Dr. Romero, do you have anything to add to that?
Only to reinforce that. I think that the issue of going out in public, really in today's environment, what we're seeing here does require use of a mask. I have one in my car, my wife has one in the car, and we use it every time we're outside of the car in public. It is a way to protect others, and as we discussed already, there's a very high percentage of individuals that have no symptoms whatsoever and can expose you if they're not wearing a mask.
Another question remotely, and then right back here at the table.
Governor Hutchinson, you mentioned before about regional epidemics, and so should people be wary about traveling across even the state to different regions?
No, I don't think they should worry about it at all. In fact, I just had a text from one of my relatives about, we're in Northwest Arkansas, should we isolate? And my answer is no, not unless you are in that vulnerable age category or have health conditions. we need to be out. We need to do our business. We need to live life, just do it safely and carefully. And the same thing applies as we travel around. If someone is going to a county that has a high number of cases and increase, just be mindful of that and be doubly careful to take the precautions as you go into a store or do any other activity there. So I think we just have to be aware, but that's one of the reasons that we put the data out on the Department of Health website so everybody across the state can know what's in their county. They can see it, they can be aware, and if you're on a dairy farm in Madison County, you're probably okay. You don't even have to worry about social distancing. It's natural. But obviously, if you're in an urban area and you're going to go to a barbershop, you need to be mindful of it. Yes?
Do you think we'd be in a better place now with the virus if you had done a shelter in place in the beginning?
I think everybody ought to think through that question, and I've thought through it many times. And I think the simple answer is, in my analysis, that you don't see that true anywhere in the country. States that had a very early and strict shelter-in-place order early on, you're seeing that they went through months of sheltering in place where their citizens can't tolerate it anymore, and now you see some of their cases going up. Here in Arkansas, we didn't have that early spike in cases. We had a very modest number of cases. We did not shelter in place, and that allowed us to keep our economy moving. It did not create the stress in our human lives that we would have had otherwise. Can you imagine if we would have sheltered in place starting back on March 11 to shelter in place through all of March, and then in April and May, and now in June, and now that you're in June, you've sheltered in place this far, how in the world, with this increase in cases, can you open up? And so at some point you open up just like California has done, because there's no other choice but to open up. Even though they've been sheltered in place all through this time, their citizens just won't live with it any longer. And so I think we made a very good decision that was prudent for Arkansas, but for sure history will be a judge of that.
I guess with adding some of the National Guard's folk to contact tracing, is there a way to quantify how far behind they've gotten just with the recent surge?
They've been very faithful. They've been getting it done, and so I've raised that question numerous times. And every case we're doing the contact tracing on. But I know also, though, that whenever you have this level of increase, it's getting stretched thin. And so I want to bring more people on, and we also want to have that plan for the fall, that we have even a greater need. And you have to realize also that we have a number of industries, and Tyson's is one of those, but Simmons Industry, others, they're doing their own contact tracing. Walmart, and so if they identify a positive case of an employee, then they're going to do their own set of tracing and who they've been in contact, and do the follow-up, and obviously coordinate that with the Department of Health. So there's a lot of resources being applied there, but the best resource is what's directly the tool of the Department of Health, and that's what I want to increase. Yes?
Just looking at today's numbers, the impression you get is whatever we're doing is not working. Is that how you see it? And if either way, I mean, how are we going to change this trajectory?
That's a good question, and no, I don't see that what we're doing is not working. We might not be doing it well enough. I think the strategy is the right strategy. Are we implementing the strategy in terms of social distancing, being careful, and doing the public health requirements? We can do better. But you also look at it, nationwide, and so many states are dealing with exactly what we're dealing with, and the unpredictability of this virus and how you plan for what's going to be like in July and August is difficult. I was looking at, should I go on some economic development trips later this year? I don't know. What's it going to be like? I know I want to and I need to, but what is the number of cases here? What's the number of cases there? What's the growth pattern like? And so this is difficult for everybody who is implementing strategy. Look at all of the think tanks that are doing the modeling. How have they done? And did anybody predict where we are right now? And so we work through it. We're using the best data and science. We do have a good strategy. We just have to really execute on that. Final question.
I guess where are contact tracers? Is it still mainly workplace environments that they're seeing spread?
Yes, it's a workplace, but beyond that, here again, if you have somebody in the workplace that's positive, you also have the connection with the community. You've got their family, you've got the people they might go to church with or otherwise, and so that's what we trace. Dr. Romero, did you have any other comment on that?
No, I think that's fine.
Okay. All right, with that, this is Friday. I hope you all have a very good weekend. We'll be praying for good results this weekend, but we'll be back with you next Monday. Thank you very much.